Alright guys, now we're going to look at part 2 of chapter 22, where we're going to focus in on more of the immunity, not so much the lymphatic system, but on how the immune system actually works. So our immune response includes two kind of branches. We have the innate immune response and we have the adaptive immune response. Now guys, immunity is defined as the ability to resist infection or disease. It's your ability to resist getting sick for the most part. So when we look at immunity, you have your innate immunity. This is what you're born with. Everybody is born with this type of immunity. So this is kind of like your first line of defense, like your skin, things like that. Then you have your adaptive immunity. Your adaptive immunity changes over time. As you're exposed to different things, it's going to adapt or change. And so that's what we're looking at here with the adaptive. Now the adaptive immunity also gets branched into two areas. It can be cell mediated, meaning it fights off the invader with cells, or it can be antibody mediated, where the cells produce antibodies which help fight off the invader. So we are going to be looking first at the innate, the system you're born with. Then we're going to look at the adaptive and the two branches that are located in this group. So when we talk about inborn or innate immunity, this is your non-specific immunity. It's your resistance to disease that's not going to be specific to a particular disease or specific to a person. Everybody has the non-specific immunity. So when we look at this, we need to understand what a pathogen is. Pathogens are things that make us sick. They're disease-causing organisms. These are normally microscopic, not always, but you have things like viruses and bacteria, which we hear a lot about, making people sick. Fungus that can also make us sick, so can different parasites. Now parasites can be protists, like amoebas, or they can even be worms. But these are just some examples. Now each one of these, whether it's a virus, bacteria, fungus, whatever, it's going to attack in a different way. So our body needs to be able to react no matter how it's attacked. Now your susceptibility is your lack of resistance. If you're more susceptible to catching a cold, that means that you're lacking the resistance of it. If you're more susceptible of a certain disease, it's because you don't have the ability to fight it off. So guys, if you're taking a look at this chart over here, you're going to see that this is going to be your non-specific. It talks about your physical barriers, phagocytes, extracellular killing type cells and stuff like that. These are going to just kind of be talked about in the next couple of slides. So the first line of defense I want to talk to you about is your mechanical and chemical barriers. First of all, you have your skin. Your skin provides a physical barrier against invaders. Okay, it helps keep things out, but also it sloughs off dead cells, which takes bad things with it when they slough off. The skin also secretes sebum. Sebum contains a fatty acid. This fatty acid will help inhibit bacteria and fungal growth on your skin. Also, your skin has an acidic pH. It has a pH between 3 to 5, which a lot of times inhibits most pathogens from growing. It also is going to have where sweat is located on your skin. Sweat contains lysozyme. Lysozyme is an enzyme that breaks down bacterial cell walls. So your skin itself, besides being a physical barrier, it also has a lot of chemicals that get released by it to help protect you. We also see you have mucous membranes. Anytime you have an opening that goes into your body, whether it's your ear, your nose, your mouth, something like that, you're going to see that it's lined with a mucous membrane. This is to help trap invaders in the mucus, to help get rid of them before they gain access deeper into your body. In your nose, you have nasal hairs. Nasal hairs are there to filter. They will catch a lot of times stuff that comes up into your nasal cavity before it makes you sick, or it keeps it located in the nose. It'll catch invaders, dust, pollen, things like that. We also have cilia. The cilia is found on a lot of your cells. The cilia in those mucous membrane areas are little finger-like extensions, and they'll sweep up the invader. Normally they'll sweep it up into your throat, where you can either cough it up. That's sometimes what happens when you cough it up and you spit it out, or you'll swallow it. So coughing, sneezing are involved in this. Now, the lacrimal apparatus we talked about back in special senses. This produces tears. Remember that it produces that enzyme lysozyme, which also helps fight invaders. Also, one reason why a lot of times when we sweep up into the throat, instead of coughing out a substance or invader, we'll swallow it. This is because your stomach contains acid. You have acidic pH in your stomach, and it kills most organisms that it comes in contact with. We also see there's bile salts that are found in your intestines. A lot of them will kill other organisms. And also we remove invaders through any kind of fluid that we release, whether it's tears, saliva, urination, defecation, vomiting. All the purposes of those things are to dilute the invader, the problem, and to wash it away. All right, so that's what we see with our first line of defense, which are your mechanical and chemical barriers. All right, your second line of defense is your non-specific antimicrobial substances. These are going to be not specific to a certain bacteria, virus, or anything like that, but they're a little more advanced than your first line being like your physical barriers. So one of the chemicals here that's really important are what we call interferons. These are proteins that are released by virus-infected cells. So when a cell gets infected with a virus, the virus already gained access, this cell will actually give off an interferon. Interferon isn't going to save that cell that's already invaded, but it can go to nearby cells and bind to them. And what it does is it tells them that, hey, I'm invaded, I've got an invader, protect yourself. And so it makes them less susceptible to getting that viral infection. So it also inhibits viral replication when the virus gets inside. Interferons also enhance what we call phagocytosis. Phagocytosis is going to be other immune cells that we'll see later. It increases their ability to consume it, to take in the problem and digest it and get rid of it. And also interferons help with tumor suppression. Okay, so they actually help get rid of cancerous cells. The next set of chemicals are called the complement system. The complement system is a group of proteins which react in a sequence. They're like a domino effect. One is going to initiate two, which initiates three, and so on. And the whole point there is they're there to help destroy the foreign invader. Certain of these complement hormones, that's what the C there stands for, is the complement. They're also involved in your inflammatory response. Your inflammatory response is the whole redness, swelling, heat, pain that comes along with a damage to an area. And the complement system is there. Now, these complement proteins do travel through the blood, but they're inactive. Whenever there's an issue, a problem, or an invader comes in, they do become activated to do their job. We also see there's what we call natural killer cells. These natural killer cells are a type of lymphocyte. These are really important because they're able to kill many different things. Later we're going to see lymphocytes are very specialized a lot of times, where they only kill bacteria, they only kill viruses. These guys, with being natural killer cells, they can pretty much kill all kinds of different pathogens and tumor cells. They're not specific to a certain type. One thing that's unique about them is we don't completely understand how they do this, because all of the other white blood cells, especially the lymphocytes, are very specific on what they can fight. These guys are not. And so there's a lot of research being done to why they are so different. Now, phagocytosis is important to look at. Phagocytosis is the ingestion and destruction of any foreign invader that kind of gets into the body, or even foreign matter that should not be there. Now, phagocytes are cells that actually, like almost Pac-Man, and eat the invader, destroy it, and get rid of the pieces. There's a couple of examples of these. There's granulocytes, which we talked about back in the blood chapter. These would be like your neutrophils or segs, as well as your eosinophils, but also macrophages, which mature into monocytes. These guys are all considered phagocytes. They do phagocytosis. Now, there's 4 phases to phagocytosis, though. These guys can't eat whatever the invader is unless they can get there. And so the first step to phagocytosis is what we call chemotaxis. A lot of times these cells that are damaged, or who have detected the invader, they release chemicals that draw these phagocytes to the area. So they do chemotaxis and taxi them in. The next thing that has to happen is that they have to adhere to the invader. They've got to connect to it. Once they connect to it, they can ingest it and take it in, and then they kill it. So there's the 4 steps to phagocytosis. Now, these are shown in your textbook in the picture that you can see here. That's found on page 813 in your book. So you have chemotaxis, where we bring the phagocyte to the area. Number 2 is adherence. We connect to it. They then take it in through ingestion, and then they digest it and kill it. Digestion and killing are kind of in the same step. So they kill it. And so over here on this side, you can see that there's a picture of an actual white blood cell coming in contact with a microbe or a bacterial cell. Okay, doing the whole idea of being able to consume it and take it in through ingestion to destroy the invader. Now, before we get much further, I do want to talk to you about the inflammatory response, what inflammation is. You've heard about inflammation before. Inflammation occurs anytime body cells are damaged. They could be damaged by invaders. They could be damaged by some sort of physical agent, like you got cut by something, a carpet burn, something like that, or even chemicals. So any kind of damage to your cells, you're going to see an inflammatory response that takes place. Now, there are 4 cardinal signs to inflammation, okay? 4 things we see when inflammation is present in an area. The first thing is redness, okay? We see redness. We also see heat, swelling, and pain. And so in the picture over here, you're going to see why we get these different things. So a thorn has gotten into your skin somewhere, okay? So you see the thorn stuck here. We see that when those cells are damaged, they are going to release the chemicals that causes inflammation to take place. These chemicals will then talk to the blood vessel. The blood vessel then will bring more blood to the area. That causes the redness. So we also see the next thing that happens is when the blood comes into the area, it brings heat. Because remember, our blood is a little hotter than our body temperature, so that brings heat. These chemicals also cause the blood vessel to start to leak. When they start to leak, we see plasma come out. That causes swelling because we have accumulation of fluid in the area, which causes the edema or swelling. When that takes place, it puts pressure on our nociceptors, which are our pain nerves, and you have pain that comes along with it. So these are the 4 cardinal signs of inflammation. All right, some other chemicals we want to talk about when it comes to like inflammation is histamine. Okay, so we're going to kind of talk about the series of what happens during a problem with inflammation. So histamine, guys, is released by many body cells when they get injured. Histamine causes vasodilation, so it makes the blood vessels bigger, which causes more blood to come to the area, and it causes them to be more permeable so that they leak. So they leak fluid out so they can bring more white blood cells to the area. Vasodilation increases blood flow to the damaged area and helps remove dead cells or any toxins that the invader has produced. This increased permeability of the blood vessel allows plasma to leak out, as well as white blood cells, antibodies, other phagocytes, coagulation factors, complement proteins we talked about that circulate through the blood. It allows all of them to come into the area to help fight the invader. The phagocytes frequently die after they perform their duties. Once they kill off the invader, they also die. Now, these white blood cells, along with the dead invader, they could form a pocket within the skin a lot of times, and this is pus. Okay, so when we see pus in an area, that means that our white blood cells have done their job, they've gotten rid of the invader, but there's been an accumulation, which is the pus. If pus does not drain or cannot be reabsorbed by the body, it results in an abscess. Abscesses are prolonged inflammation, which then could potentially cause ulcerations and bigger problems. All right, so they can cause many issues. Together with the vasodilation and the increased permeability, we see the 4 cardinal signs. We see redness, which is also known as erythema, heat, which is fever, swelling, which is the edema. The pain comes along with all of these. The pain is due to the increased pressure in the area, a lot of times due to the swelling, or it could also be irritation to the nerve fiber because they also will be stimulated by some of the chemicals given off by the damaged cells, like the kinins and the prostaglandins, which we've talked about back in hormones, because they're types of hormones. The next thing I want to talk about is fever. Fever creates a less favorable environment for pathogens, and so heating up the area, it's like turning up the heat, makes them uncomfortable. They don't want to be there. Fever also intensifies the effects of interferon with some of those chemicals we talked about, and fever also speeds up cellular repair. The thing is, though, when we talk about with fever, it is only to a certain point. If fevers get too high, then we start to see cellular damage and even issues in the brain if fevers are too high or they stay too high for too long. You can look on page 814 in your book, and this gives you your non-specific resistance. There's a table there that lists all of these different things we just talked about, and then what they do, how they fight off the invader. And remember, these are all considered non-specific, so it doesn't matter what the invader is, they're all going to act the same way, no matter if they're attacking a virus, bacteria, fungus, or whatever it might be. Now we want to switch gears and we want to talk about specific immunity. Specific immunity is going to be a resistance to disease that's adaptive, meaning that it changes, okay, and it's going to change over time. Everybody's specific immunity is different because we've all been exposed to different things throughout our life, okay, different infections, different invaders. All right, now these do revolve around 2 special cells, the B lymphocytes and the T lymphocytes. Now, it doesn't matter which one we're looking at, they all come from stem cells in the bone marrow, which we looked at in the blood chapter. These lymphoblasts, remember blasts are juvenile cells, they get programmed. If they get programmed in the thymus gland, they are going to become T cells. Some of these T cells, they develop surface proteins that are called CD4 cells. They're going to then be CD4 T cells. A lot of times they're termed as helper T cells. On the other hand, other T cells, as they mature, they develop surface proteins that are called CD8 proteins. These are CD8 T cells, also known as cytotoxic T cells. Now, lymphoblasts, when they get programmed in the bone marrow or the spleen, they are known as B cells. Okay, so they are going to have a different job than the T cells. Each type of lymphocyte has its own function depending on what type it is, and it's also going to have its own antigen receptors. So it's going to be very specific about what it can fight, and it can really only fight one thing. Once they become specialized in fighting that one invader, that's all they can fight. We have to have other B and T cells that can fight other and new invaders. So the adaptive immunity, guys, takes time to develop in order to fight off an infection. Now, an antigen, guys, is any foreign molecule which enters your body and causes an antibody production. So antigens are usually large, complex structures, and they do contain proteins, and these proteins do not match you. Since they don't match you, that's when your immune system realizes that it does not belong and that it's foreign. Once it does that, it starts to build up a specific immune response against the invader, once it knows that something that does not belong there has entered the body. Now, once we know something that has come in that shouldn't be there, we have to build a response. And this is what we call colonial selection. This is when an immune cell, once it has encountered an invader, it starts the process of proliferating, which means making more of itself. Okay, it goes through dividing, and it will differentiate, meaning that it's going to become very specific to that one antigen. Now, this can create what we call effector cells. Effector cells are the cells that actually do the work to destroy the invader. These can be the cytotoxic T cells, the helper T cells, or plasma cells, which are mature B cells. Okay, plasma cells are mature B cells. On the other hand, we also see through this clonal selection that it's going to create memory cells. Memory cells are going to be long lifespan cells. They're going to live for a very long time, and they're going to provide you with a memory of that invader. That way, when you come in contact with that invader again, you have a fast response against it, all right, because your body remembered it's seen it before, and so it fights it quicker, and you may not get any symptoms of being sick because your body remembered that it has seen it before with these memory cells. All right, so you can have effector cells who actually destroy the invader and memory cells who remember what they were fighting and will remember it the next time you see it. All right, this brings us to major histocompatibility complexes, or MHCs. These are antigens which are unique to your cells. Everybody has their own unique set. These are what we call our self-antigens, and this is what allows your effector cells and any of your white blood cells to distinguish what belongs to you and what doesn't. Okay, this is why whenever individuals need a transplant, they have to find cells that are the closest match possible, because any slight difference, your immune system will be able to pick up and potentially fight off the transplanted organ or tissue that they put in your body. All right, so if we take a look here, this is again a flow chart that just shows you the two types or two branches of the adaptive immune system. So you have your adaptive defenses. You have the cell-mediated over here, which is going to do phagocytosis and activate T cells. These T cells, when they're activated, they find the pathogens and attack them through phagocytosis, or they can release toxic chemicals that kill the invader. On the other hand, if we use antibody-mediated immunity, that's going to activate B cells, which then transform into plasma cells that produce antibodies. Antibodies then attack the invader. Now, if you'll notice, though, there's arrows that go back and forth. These guys are always constantly communicating with each other. Most of the time, it's not just one doing the job. It's both of them working together, all right? But sometimes one will take the lead over the other branch, but they do work together and communicate with each other. All right, so in your textbook on page 815, it shows you kind of the development of your adaptive immune system. It shows you where the stem cells are going to be coming from the bone marrow. If they mature in the thymus, you're going to see your cytotoxic T cells and your helper T cells. This is the CD8 and the CD4. You'll notice they are structurally different, which means they'll function differently. We also then see mature B cells. When they leave, they'll have these little Y-shaped structures on them. These are going to help them produce antibodies, which are the red structures at the bottom. So we have the two branches of the adaptive immunity. So let's take a look at each of these in more detail. So the first we want to look at is the cellular immunity, or what we call the cell-mediated immunity. This is when cells are going to attack cells, and it's very specific. These are going to include your cytotoxic T cells. These are the T8 cells, or what we also call the T killer cells. They contain the protein on their surface, CD8. They destroy foreign invaders by one of two ways. They can use a chemical called proferin, which is going to cause lysis of the cell membrane, which causes the cell to die. And they can also use what we call lymphotoxin, which is going to cause damage to the DNA. This damage to the DNA then is going to also kill the cell. These are really important in attacking cells that have been infected by viruses. We can't save the cell who has been infected, but we can kill the cell, and that way the virus doesn't continue and infect any other cells. So it's almost like it's sacrificing itself to protect the whole organism. All right, so the other T cell that's located here is the T helper cells. These are the T4 cells, or the ones that contain the CD4 protein. These guys are going to help the process, thus their name. They are going to secrete a lot of different chemicals, and these chemicals are going to help fight off or get rid of the invader. And so when we look at this, they can release what we call interleukin 2. Interleukin 2 is going to stimulate other T cells, B cells, and natural killer cells to come to the area and to fight. We see interleukin 4, which is going to stimulate B cells to come and do their job. There's also gamma interferon, which stimulates phagocytosis, so it activates those macrophages that come in, and they're the big cells that Pac-Man and eat the invaders, and they clean up the debris a lot of times after something has been defeated. And we also see it has this what we call macrophage migration inhibiting factors. This keeps the macrophage in the area. If you recall back from the blood chapter, macrophages have the ability to kind of roam and move around. We don't want them to leave if they're there to fight an invader. So they will inhibit their movement, so they stay there until the invader has been neutralized. And there's also other chemicals they'll release. These are just some examples. So guys, in your textbook it shows you the activation of the two different types of T cells, with it being the cytotoxic T cells. Some of them will release those granulozymes, which go in and they punch holes in the membranes. It destroys the membrane of the cell, releasing the bacteria or whatever has invaded the cell, and then they have the phagocytes that come in and destroy it. On the other hand, over here you have the other chemicals which do the same thing, but they've also killed the DNA in the invader, which then they have to have other cells just come and clean up the debris. All right, so there's two different ways that the cytotoxic T cells can work, and both of these are shown here. These are found on page 823 in your book. Now, there is another T cell that's important to look at. These are called the T suppressor cells. These guys are actually going to inhibit T and B cell proliferation, so causing them not to divide anymore. These guys help inhibit or keep our immune system under control. They want to make sure your immune system doesn't go crazy and starts attacking things that it shouldn't. So these guys are going to help regulate and make sure the immune system is working the way it should and suppressing it whenever it doesn't need to be turned on or activated. Now, there's also T memory cells. These are going to be formed in response to the foreign substance. These are going to remain in your body for a long period of time to give you immunity, to give you protection against that invader, so that when we see it again, it doesn't take as long to fight it, and we can get rid of it very quickly. They remember the invader. Now, these T cells are super important because they do what we call immunological surveillance. This immunological surveillance is carried out by cytotoxic T cells. They are going to be surveying the area. They're like the neighborhood watch in the tissues. They're going to go through and they're going to look to see if there's any tumor cells that have developed. They're going to be looking for any cells that have been invaded by anything and they've put out the distress signal. They're going to be looking at all of that. They're also going to be looking to make sure that all of the cells in the area match you. Okay, so if something does not match, then they will attack it. So they're constantly doing surveillance to make sure that invaders have not come into that area of the body. All right, so the second thing, or the second branch of immunity we want to look at is the humoral immunity. This is the antibody-mediated immunity. This is where antibodies are going to attack the cells, and again, it is a specific type of immunity. The B lymphocytes produce antibodies. AB here stands for antibodies, and they are stimulated by certain foreign antigens. So when we come in contact with something that's foreign, that does not belong, these B cells are going to be activated. They develop into what we call clone cells, and they become plasma cells. These plasma cells then are going to produce antibodies. Antibodies are a plasma protein which protects the body cells from that foreign invader. Now, there's different types of antibodies. There's 5 different classes of antibodies. They are called immunoglobulins. We can see that they kind of have different roles based on where they're located and what they kind of fight. We see we have IgG. This is going to be what we have the most of when we take a sample of blood and stuff like that to see how many antibodies. IgGs are normally the most abundant. They're involved in your secondary immune response. So they're there to fight something that you've seen again for the second time. We also see that you have IgMs. These are the largest antibodies in size, and they're involved in the primary response, so the first time that you see an invader. IgAs are found in your body secretions like your tears, saliva, also breast milk. This is the way that we pass on immunity to babies through breastfeeding, is these IgAs, which are found in body secretions. We also have IgDs. IgDs are normally in such small amounts that we're not really sure exactly what they do, but we do know that they're important because they are still found in samples. And then you have IgEs. IgEs are involved in allergic reactions, including anaphylactic shock reactions. So a lot of times if you have allergies or having allergic reactions, IgEs are going to be in large amounts. Now, you'll notice, especially with the IgGs and the IgMs, we talked about a secondary immune response versus a primary. Primary is the first time that you see the invader. And you can see in the picture over here, in the primary response, you see that the IgMs are going to be activated first. Then IgGs will be activated. However, the second time that you're exposed to this, down the road, the IgGs take over and they help neutralize a lot faster than the IgMs. The IgMs give the same type of response they did the first time. And a lot of times this has to do with their size. In a minute I'll show you a picture and you'll see that the IgMs are a lot larger than the other antibodies. Now, we also see that there are B memory cells. These B memory cells are going to remain as activated B cells, so they're ready to attack whenever they come in contact with the invader. They don't actually become the plasma cells, but they do remember, so that when you are re-exposed, they remember so we can fight it off again quicker. So if we take a look here, guys, this is kind of how the B cell works. When the B cell comes in contact with the micro, the foreign invader, it turns into a plasma cell. These plasma cells produce the antibodies, which you see at the bottom down here in red, and they're going to then go attack the microbe or the invader. We also see that memory cells come into play. However, in this picture, you may notice too, though, that somebody else is there to help. The helper T cell is the connection between the two sides of specific immunity. They're going to be the ones that connect the antibody immunity to the cytotoxic immunity with the cells. All right, so here is a table that shows you the classes of the antibodies. It shows you their shape. It shows you also their size. You can see the IgMs are a lot bigger than the other types. And it also describes some characteristics. Take a few minutes and look at this. You can look at it in your notes, but you also have it in your textbook, table 22.3. All right, so now let's talk about that primary immune response, the first time that you come in contact with the invader. This occurs when you have your first encounter of the foreign invader. One example would be the first Rh positive pregnancy in an Rh negative mom. This is going to be a new, the Rh positive blood, when it mixes with the mom's, it's an invader, and so the body's going to notice it as an invader. It could be your first encounter with chickenpox. It could be your first time that you got a vaccination or a shot that helped prevent a disease. All right, these are all examples. It's the first time that your body has seen it. What happens is there's always what we call a latent or lag phase that takes place. This could be several hours or days where there's no antibodies detected in your blood. Your immune system has to have time to build a response, especially since it's the first time it's seen the disease, and it's going to be very specific on how it fights it. So antibodies are going to be produced. Again, the IgMs are produced first, and then the IgGs will be later. So these antibodies could last for about a month that we can detect them in the blood, and this is to just help make sure that you have it. If you come in contact with it again, it can take care of it very quickly. Now, a secondary immune response is going to be when you've seen it again. It's any subsequent response or repeated exposure to that antigen, so that foreign invader that comes in. Now, within 2 to 3 days after you've been exposed to it a second time, you'll see a very high titer of your antibodies. This is going to remain high for a lot longer. Okay, it tapers off a lot slower because obviously you've seen it a second, third, or fourth time, which means we need to be able to fight it. You're coming in contact with it pretty regular. So examples would be a second Rh positive baby is the one affected by that hemolytic disease of the newborn, which we talked about in the blood chapter. But it can also deal with the second, third, fourth, fifth, sixth time you were exposed to chickenpox. You weren't just exposed one time, but you only got it one time, hopefully. Okay, so each time you're exposed again, these guys are going to fight it off, hopefully, before you get sick. And then the same thing when you get booster shots. Anytime they do a vaccination booster, they're trying to boost your immunity and increase your production of those antibodies. And this is important, like if you were going to travel overseas into areas where certain diseases are more prevalent, you may need a booster shot to help protect you against them. Now, this brings us to types of specific humoral immunity. There's 4 types we want to talk about when it talks about producing antibodies. All 4 types are acquired. You do not have them at birth, okay? So they're going to develop over time. So the first type is what we call natural acquired active immunity. Now, you're going to notice that natural and active are both bolded. The reason, if it's natural immunity, it means it's not artificially acquired. You didn't get it from a syringe. It means you were exposed to it naturally. The active part means that the antibodies that were produced, you produced yourself. Your body actively made the antibodies, so you didn't borrow them from anybody. This type of immunity comes from a natural infection, or like an Rh negative mother having an Rh positive baby. Okay, you are exposed to chickenpox, you have the chickenpox, you naturally acquired it, and you actively fought it. Okay, that's what it's talking about here. The next one is also natural, meaning it did not come from a syringe. However, the immunity is passive. If it's passive immunity, this means the antibodies were borrowed from someone else. This person did not make them themselves. We borrowed them. You now do not have a lifelong immunity against it because it was only borrowed. It was passive. This is the placental transfer of antibodies from mother to fetus. Okay, when the baby is born, the baby has a temporary immunity, a temporary protection from the mom that lasts about 4 to 6 months. This allows for the baby's immune system to then start to take over because it hasn't done any job yet because the mom's body is always taking care of it. And so it gives that time for that crossing over to take place where the baby then can do natural active immunity instead of relying on the passive immunity passed down by the mom. The next 2 are going to deal with artificial. Artificial means you acquired it by an injection. So an artificial acquired active immunity means I've injected you with something like a vaccine and you then actively made antibodies against it. Okay, this is where I gave you a dead or a non-threatening version and you fought it off yourself. So you have the antibodies to fight off that particular invader. The next one's artificially acquired passive immunity. This is artificial, meaning you acquired it by an injection. Okay, so again, it's an injection, but this would be where antibodies were produced by another person. They were borrowed. A lot of times this is going to be dealing with antitoxins. Also, the RhoGAM shot is an example of this. We artificially give it to you through a shot, but the passive immunity, so it's only temporary protection. It's not protection for a long period of time, just for a temporary period of time. All right, the last little bit of these notes is what I want to talk to you about and how the immune system affects like organ transplants or when you have an immunodeficiency or when your immune system gets hyperactive and it's acting the way it shouldn't. All right, so let's look at organ transplants first. There's 4 types of organ or graft transplants, which is tissue transplants. There's an autograft where the graft transplanted is from one side of the body to another of the same person. This case, you do not have a likelihood of rejection. This would be like a skin graft where you needed a skin graft on your arm, so they took some skin off your leg and placed it on there. Another one's called the isografts. These are grafts between identical twins. They have the same DNA, so again, the chance of rejection is very low. The next one are allografts. These are transplants between individuals that are not identical twins but belong to the same species. So this would be if you're a match with another person and you get their kidney or their heart or something like that. You're thinking, well, of course you're going to get organs from kidneys. However, there's a third type. Xenografts means you got a graft or a tissue from another species. We don't see this very often, but one good example of this is pig valves. We can take pig valves out of a pig's heart and put them into our heart to work. And the same thing with bovine or cow valves. All right, it means it came from another species, not from a human. Now, in order for the body to take some of these types of grafts, we need to prevent the tissue from being rejected, especially in allografts and xenografts. This a lot of times is accomplished by putting the person on immunosuppressant drugs. What this does is it suppresses the immune system enough so that the body does not fight the new tissue. It doesn't fight the new heart, doesn't fight the new kidney, and that sort of thing. However, it does put the patient at risk that if they come in contact with a strong disease or a strong flu strand or something like that, it could make them pretty sick. All right, but immunosuppressant drugs are to suppress the immune system so the immune system does not attack the new tissue or new organ that the individual got. All right, the next thing I want to look at is immunodeficiency. So immunodeficiency means your immune system is deficient, it's not working properly. This could be congenital, meaning that you're born with an issue, or it could be acquired. Throughout your life, you acquire it through different conditions. It can affect the function of producing immune cells. It could affect the phagocytes themselves and how they work. It could affect the complement. Those proteins that we should have could be abnormal. There's a lot of things that could be wrong. SCID is example of one that you're born with. This is a severe combined immunodeficiency syndrome. It's genetic. A lot of times with this genetic condition, we see that there's a marked deficit in the formation of B and T cells right off the bat. They are abnormal in their cells having what we call interleukin receptors. We also see they have defective and adenosine deaminase. This is a type of enzyme. This enzyme takes care of things that actually are lethal to T cells, so it helps get rid of them so T cells can live properly. If this stuff builds up, it kills the T cells that actually are made. So it's a combination of issues. SCID is fatal if untreated. Treatment is with a bone marrow transplant. The issue is at the base level with the stem cells, and so the only way to be able to overcome this would be with a bone marrow transplant. Now, acquired immunodeficiency means that you acquire it over time. There's different types of acquired immunodeficiency. One example is Hodgkin's disease. This is a cancer of the lymph nodes. This leads to immunodeficiency because it depresses the lymph node function. Remember, inside the lymph nodes are B cells and T cells, so they can't do their job, and it causes issues. Another acquired immunodeficiency is acquired immunodeficiency syndrome, which we term as AIDS. This cripples the immune system by interfering with the activity of the helper T cells. Now, if you recall, the helper T cells, it links the two sides of our specific immune system together. HIV is the virus that actually takes this particular cell out of the equation. They attack helper T cells on purpose so that one side of the immune system can't talk to the other, and so sometimes it's kind of like, well, I thought they were going to take care of it, and the other side's like, well, I thought you were going to take care of it, and it causes a lot of issues. AIDS is characterized by severe weight loss, night sweats, and swollen lymph nodes. A lot of times the individual is going to die because of opportunistic infections. Their immune system has been compromised, and so they'll get sick with pneumonia or the flu or something like that, and it causes major damage and potentially death. All right, and so that's what it's talking about with opportunistic infections. These are things that normally don't make you sick, but if they get the opportunity, they will. So let's talk a little bit about AIDS. AIDS is caused by human immunodeficiency virus, or HIV. It is transmitted by body fluids like blood, semen, or vaginal secretions. HIV enters the body either through blood transfusions. This is one reason why they check blood in a lot more detail now before they put it in blood banks and things like that. Also, contaminated needles could contain blood that has HIV. Intimate sexual contact. This does also include oral sex. Oral sex can pass on HIV as well. Now, HIV is going to destroy your T helper cells. That's what the T with the little H means. It's going to destroy the T helper cells, which then is going to depress your cell-mediated immunity. However, the T helper cells also talk to your B cells, so it's going to depress your antibody immunity as well. HIV multiplies in your lymph nodes throughout what we call the asymptomatic period, meaning you have no symptoms at all that you even contain the virus. Symptoms a lot of times can appear within a few months, but sometimes it could be as long as 10 years before you actually see any symptoms of this virus being present in your body. Okay, that's a big deal. 10 years of not even knowing that it's there and not receiving treatment can be a problem. If you suspect that you've contracted HIV, you'll have to do a series of tests. HIV will stay dormant or latent for a while, and it may not be detected for up to a whole year after you've been exposed. All right, and so a lot of times you'll have to take a test immediately, then at 3 months, 6 months, 9 months, and a year. And by the year mark, if you're still HIV negative, there's a good chance you do not have HIV. Now, HIV enters your cells and it uses a special enzyme called reverse transcriptase to produce its DNA from its RNA, okay? Because it's an RNA virus, it's going to make its DNA. This DNA is then known as a provirus. It directs the cell, your cells, your host cell, to make viral RNA. So instead of your T helper cell helping out and helping your immune system, it actually hijacks it for it to make more HIV cell or more HIV viruses. So the viruses start to replicate so they can infect other cells. HIV's reverse transcriptase is not accurate, and so it does produce frequent errors. These high mutation rates cause it to become very drug resistant easily. So that's why certain drugs have not given us that advantage. They work for a while and then they don't work anymore. So it's very hard for us to even treat and try to figure out how to get ahead of HIV due to this high mutation rate. Treatment does include reverse transcriptase inhibitors to try to inhibit the whole process. Protease inhibitors, these protease inhibitors again are against the provirus, so it's the part of the DNA. And new drugs currently being developed are to block how HIV enters into your cells. So it doesn't allow them to get in at all. The hope is that something might work, but actually treatment for HIV is a combination of this stuff, and AIDS doesn't develop until your immune system gets down to a certain level where your immune cells are too low and you cannot fight any kind of infection. All right, so now I want to talk a little bit about autoimmune disease. Autoimmune disease is where your immune system loses its ability to distinguish you from something else. It thinks that your own cells are the problem. It thinks that you are something in you is attacking you when it's not there. This is where the body produces what we call autoantibodies. These autoantibodies start to destroy your own tissues. Now, autoimmune diseases a lot of times get named or classified based on what tissues they're attacking. Okay, so whatever autoantibodies are attacking, that determines what kind of autoimmune disorder is present. Multiple sclerosis is where we see the immune cells attacking the oligodendrocytes in the brain. It's a central nervous system. Whereas when you see type 1 diabetes, it's where the immune system is attacking the pancreas. Lupus, we see it attacks lots of areas. Rheumatoid arthritis is the joints. So in each of these examples of autoimmune disease, and there's a whole lot more out there, they're attacking a specific area of the body, okay, in a specific way, and that's what causes the autoimmune problem. Now, one way we think this happens is a lot of times if the determinants of a foreign antigen resemble the self, meaning they're closely related to what yours looks like, the antibodies made for the foreign agent could cross over and start attacking yourself. And we see this happening sometimes on those valves when we talked about the heart, how certain kinds of fevers can cause issues on the valves, especially on the left side of the heart. This could be what's happening where the immune system starts attacking the valve instead of the actual invader. Now let's switch gears and talk about when the immune system kind of goes crazy. Now, autoimmune is an example of this, of a hypersensitivity, but this is when your immune system does not stay in check. It gives a very exaggerated response to something it shouldn't. There are 4 types of hypersensitivities. So the first one is called acute or type 1 hypersensitivity. This actually begins within seconds after you've come in contact with the problem, and this is what we would call allergies. A lot of times the problem's an allergen, and so when you come in contact with that allergen, the first time you're normally asymptomatic, but it sensitizes you against that. So the next time you come in contact with that pollen, that dust, that bee, whatever it might be that you're allergic to, your cells release histamine and inflammatory chemicals, which can cause a major issue at that area. It could be local or it could be systemic, where it goes through your whole body, shutting down your systems, and it could put you into like anaphylactic shock. Reactions could be as simple as a runny nose, itchy, reddened skin, or even just watery eyes. But if the allergen is inhaled, we can see that asthmatic type symptoms can appear. This can cause constriction of the bronchioles and restrict the airflow to your body. If the allergen is ingested, taken into your stomach, so like you're allergic to peanuts or something like that, it could cause cramping, vomiting, and diarrhea. We also see antihistamines can counteract some of these effects. So if you're allergic to a certain kind of bite from an insect, you can put an antihistamine on it. A lot of times it may help reverse that. Right, So this is going to be the type 1 hypersensitivity. Now, this could lead to something called anaphylactic shock. If you have an allergic reaction that directly enters the blood, like due to an insect bite or an injection, we see that basophils and mast cells are enlisted throughout this causes a systemic release of histamine. So the histamine gets released throughout your whole body, which causes constriction of the bronchioles, making it hard for you to breathe. It causes sudden vasodilation and fluid loss from your bloodstream. So we see fluid leaving the blood. This causes your blood pressure to bottom out, and we see that you go into what we call hypotensive shock. If this is not reversed quickly, it can cause death. What's the main treatment for anaphylactic shock? Well, an epinephrine pen, okay, or an EpiPen. A lot of times individuals who have major allergies, they carry these. Epinephrine is going to reduce what's happened. It's going to cause bronchodilation. It's going to cause vasoconstriction. It's going to help reverse what has happened due to you coming in contact with the allergen. Alright, so the next type is called type 2. This is the subacute hypersensitivity. This is caused when IgMs and IgG antibodies are transferred via like blood plasma or serum. The onset is a little slower. It's not immediate like you saw in type 1, but it will happen within 1 to 3 hours after you've been exposed. It can last for a longer period of time, about 10 to 15 hours. So the onset is slower, but it also lasts longer. This would be cytotoxic or type 2 reactions. This would be like if you were given a blood transfusion that didn't match. You were type A and they gave you type B. Your body would react to it. It doesn't do it right away. It notices it doesn't belong and it fights those red blood cells, but it takes time and it can make you very sick for a period of time. So this is a type 2 subacute hypersensitivity. Now, type 3 is also a subacute hypersensitivity, but it is called an immune complex hypersensitivity. This is when antigens are widely distributed throughout your body and your blood, which is normal. However, they become insoluble by attaching to something. They create an antigen-antibody complex that builds up, and then these complexes can't be cleared from a certain area of your body. So they start to build up, and they can block that area or that organ. This can cause intense inflammation due to damage. It can cause local lysis of the cells, where the cells start to rupture, and death can occur depending on how many organs it affects and it shuts down. One example of this is a type of autoimmune disorder, which is lupus. Lupus can start affecting some major organs and shutting them down due to the fact that they create these immunocomplexes. Okay, so this is a type 3. Now, type 4 is the delayed hypersensitivity. It's going to have a slower onset, which takes 1 to 3 days before you start to see a problem. This could be mediated by mechanisms involving delayed hypersensitivity T cells and also cytotoxic T cells. The cytokines from activated cytotoxic T cells are mediators in the inflammatory response. Antihistamines are ineffective, and corticoid drugs are used to provide relief. Okay, those basic antihistamines that normally would help with type 1, they do not help here in type 4. So we're going to need something stronger. An example of this would be like allergic contact dermatitis, like poison ivy. You came in contact with the poison ivy, but you didn't realize it was a problem until the next day or a few days later, and then you have a major rash, and it's more of a problem than what we saw with the type 1. It's involved in protective reactions against viruses, bacteria, fungi, protozoa, cancer, and even rejection to foreign grafts and transplants. So what we have to watch for, if you were to get a transplant, they've got to watch for this delayed hypersensitivity to make sure your body did not start attacking the organ later. Okay, it may have taken it first, but within a couple of days, if it starts attacking it, it could cause organ failure. Now, before we quit talking about the immune system, I do want to talk to you a little bit about its development. Your immune system is developed over time because it's adaptive, but stress can affect your immune system. Stress can be affected by the release of a certain hormone, which are the glucocorticoids, or more specifically cortisol. This is secreted to limit the immune response. The reason it gets secreted is because we're in that fight or flight response survival mode, and we don't need the immune system to be wasting energy. However, during very stressful situations where you are releasing this hormone long term, during like chronic stress, it can inhibit your immune system, which lowers your resistance to disease. So that's why when you're super stressed out by school or work or family or whatever, you're more prone to get sick because your immune system has been suppressed suppressed, okay? It's been inhibited. The functions of the glucocorticoids is to depress the inflammatory response. It reduces the abundance and activity of the phagocytes, okay, that help take care of invaders, and it also inhibits the interleukin secretion. So it stops your immune system or slows it down on multiple levels. The last thing we want to look at is the effects of aging on the immune system. As we get older, we see our immune system, just like most of the systems in our body, starts to deteriorate or decrease. So when we see immune system diminishing with age, we see you have an increase in your vulnerability to infections and even cancer, okay? Because remember, the immune system a lot of times catches cancer cells before they your immune system catches cancer cells before they become a problem, and so you don't see that develop until later in life. There's 4 effects of aging that really do hinder the immune system. The first is the thymic hormones. Their production is reduced as you get older. T cells become less responsive to certain antigens. They just don't respond as well. Fewer T cells reduces the responsiveness of the B cells, because remember, they're connected. They should be talking to each other. So the less T cells you have, the less B cells you're going to have that are working. And also the immune surveillance. We talked about how that's surveying the neighborhood of the tissue. Those start to decrease, and so tumor cells are going to start to form more often. Okay, so we're going to see more tumor cells, which then results in cancer. So this is the effect with aging. All right, so that completes our look at the immune system, kind of an overview of how it works. It wasn't as much detail as you would see like in an actual immunology class, but it gives you at least an idea of the 2 different sides of the specific immunity and how your innate inborn immunity does work. If you have any questions or concerns, please feel free to contact me.